Hello everyone. Every morning before I start my day or before I enter operation theatre or outpatient, there is one molecule that influences my alertness, my reaction time, and even how hard my workout feels. This is the most widely consumed drug in the world. It is so tightly interwoven in our social culture that hardly we think about its role in human physiology or performance, and that molecule is called caffeine, which is found in coffee. But here is the truth that most athletes don't realize. Caffeine can make you faster, and caffeine can quietly reduce your recovery too. Both the statements are true. I am Dr. Naveen Thiyagu, consultant orthopedic surgeon at PrajaRa Clinic, Pondicherry. So today we are not doing a coffee talk, we are doing an evidence-based clarity on caffeine. If caffeine improves the endurance by 2 to 4%, why do some athletes underperform in the long term? Because the reason is simple: performance is built at night. In next few minutes, I'll explain what caffeine actually does inside your brain, why endurance performance improves, the scientific effective dose of caffeine. You and your friend react differently to same dose of caffeine, and how to use caffeine like a scalpel, not like a background noise. That is sleep trade-off. And at the end, giving an evidence-based hierarchy as a summary. So what caffeine really does? Your brain builds something called adenosine throughout the day. Adenosine is like a tiredness signal. Imagine, I'll give you an analogy at the end. Just think it is like a tiredness signal and think of it as your body's brake pedal. The caffeine looks chemically very similar to adenosine molecule. Imagine like you have a different colored key for the same lock, but the key is the same. So what happens is caffeine goes and sits in the place of adenosine on the receptor, but it does not activate them. It blocks them. So caffeine as such does not give you any energy. It just removes the signal that says that you are tired, and that is why you feel alert. It does not meaningfully increase the VO2 max, or it does not increase your muscle power or your oxygen consumption in the muscle. It just reduces your perceived fatigue, perception of your fatigueness. And endurance is partly about how much discomfort that your brain tolerates. And this mechanism is strongly supported in neurobiology and sleep research. Caffeine is also known to enhance the neurotransmitter activity and alertness by slowing down the breakdown of cyclic AMP, a messenger molecule involved in regulating the neurotransmitter release, and by suppressing the inhibitory signals, that is GABA, in the brain. A small analogy, listen carefully, like adenosine is like the brake pedal and caffeine lifts the brake. GABA is like an handbrake. Caffeine slightly loosens the handbrake. Cyclic AMP is like the accelerator boost, and caffeine presses the turbo. What is the result? The result is you move faster but with less restraint. Why endurance improves? Let's talk about performance. In 2021, International Society of Sports Nutrition concludes caffeine consistently enhances endurance performance. Multiple meta-analysis shows approximately 2 to 4% improvements in endurance performance. That sounds small, 2 to 4%, but if you finish a marathon in 4 hours, 2% is nearly 5 minutes, and 5 minutes changes the rankings. One major reason is reduction in rate of perceived exertion, RPE. The exercise feels easier and your physiology has not transformed at all, your perception has just shifted. And the perception governs the pacing, and this is a very strong evidence for endurance athletes that caffeine improves the endurance performance. So let's come to the dose. Most research support around 3 to 6 milligram per kilogram body weight. That is for a 70 kilogram weighing person, around 210 milligram to 420 milligram. Some benefit even at lower doses. But here's a key mistake. More caffeine does not mean more performance, because beyond a particular range, the side effects rise like anxiety, jitteriness, gastrointestinal upset like acidity, heartburns, heart racing, and sleep disruption. All these side effects rises. There is an optimal zone above which the performance plateaus. This is an inverted U-curve response. That is, use enough, not excessive. So, what is the role of caffeine in strength and sprint? Now, let me be transparent. If you are a pure strength athlete, the evidence is weaker. Some small improvements in upper body strength and sprint data is very inconsistent. So, caffeine is not a magic power drug. For endurance, there is strong evidence, but for power, only modest and variable evidence is there. Why you react differently to caffeine? Many people tell me, doctor, my friend drinks coffee at 6 or 7 in the night and then he sleeps well, but I cannot. That is very real. This is because your liver uses an enzyme called CYP1A2 to metabolize caffeine, and higher levels of CYP1A2 leads to faster processing and clearance of caffeine. So some people break down caffeine down quickly and some slowly. But average half-life, if you take it, is around 5 hours. But it varies. Exposures influence the rate of caffeine metabolism. The CYP1A2 activators are smoking tobacco, chargrilled meat, cruciferous vegetables like broccoli, Brussels sprouts, kale, and heavy caffeine intake. Estimated 45% activation per liter of coffee consumed daily. Modafinil and omeprazole. Many people consume omeprazole for acidity also. So those people, these are the things that activate the CYP1A2, and there are inhibitors as well, CYP1A2 inhibitors, oral contraceptives, pregnancy, fluvoxamine, and selective antibiotics like fluoroquinolones and ciprofloxacin. These activators metabolize in caffeine faster and the inhibitors does the opposite. And here is something important. Even if you feel fine, your sleep architecture may still be disrupted. You cannot always trust your subjective feeling. So avoid taking coffee. I would suggest not to go beyond afternoon. Check for yourself how your body behaves, how you are reacting to the caffeine consumption, and then take it from there. Let's discuss about the hidden cost of caffeine consumption. Sleep. Caffeine increases the time taken to fall asleep, night awakenings, and reduction in deep sleep. Deep sleep is the most important part of the sleep. Deep sleep is when growth hormone is released, tissue repair happens, neural recovery happens. Hence, deep sleep is nearly equal to recovery. So yes, caffeine may improve today's workout, but if misused, it may reduce next month or subsequent months adaptation of your body to exercise. This is the paradox. So performance is built at night's good sleep. Thus, for patients struggling with insomnia, limiting or avoiding caffeine is often a critical step in breaking the cycle of poor sleep and caffeine intake. Some practical strategy. If you are an endurance athlete, this is not my suggestion, which I follow sometimes. Start with 3 to 4 milligram per kilogram and take 45 to 60 minutes before exercise. Sometimes I take in the middle of the exercise also, endurance exercise especially, and trial only during training. Never experiment on a race day. Set a personal caffeine cutoff time, and if you feel you have to take caffeine to be very normal, that's the time. Gradually it has to be tapered, caffeine has to be reduced. Regarding hydration myth, moderate caffeine intake in habitual users does not cause significant dehydration. This has been studied. So caffeine is not drying you out during normal use, but the context is important. Extreme endurance in heat conditions are totally different. Let me summarize the evidence. There's strong evidence. Caffeine improves endurance performance, reduces perceived exertion, disrupts sleep architecture. Moderate evidence, small strength benefits are there. Individual metabolic variability, and the gray areas and still evolving areas of exact genetic influence and magnitude and long-term adaptation impacts. So caffeine is not a miracle, it is not a villain, it is a tool. Use it intelligently. In part 2, we have several interesting topics like glucose metabolism and diabetes, heart health, neurological health, body weight and fat mass. Medical disclaimer, this video is for general education only and does not provide medical advice. No doctor-patient relationship is formed. Do not use this content to diagnose or treat any condition. If you have symptoms or medical concern, especially heart rhythm issues, anxiety, insomnia, pregnancy, hypertension or medication interactions, consult your qualified clinician. Performance disclaimer, sports supplements can cause side effects, including palpitations, sleep disruption, gastrointestinal distress, and anxiety. Test caffeine only in training, never for first time on race day. Individual variability, caffeine effects vary widely due to genetics, tolerance, sleep patterns, medications, hormonal status, and underlying health conditions. Regulatory disclaimer: competitive athletes should consult latest guidelines from WADA, World Anti-Doping Agency, IOC, and relevant sporting authorities for compliance. Stay tuned. See you in next video. Goodbye.